Hello, my name is Celena Shivers, and today I will be presenting my scholarly project titled Improving Diabetes Screening in Patients Prescribed Antipsychotic Medications. This project focuses on improving metabolic monitoring in patients receiving antipsychotic medications, specifically increasing diabetes screening to improve patient outcomes and reduce long-term complications. My project committee includes my chair, Dr. Jennifer Hopner, who provided guidance and oversight throughout the development and completion of this project. My second reader, Dr. Sarisa Moore, contributed valuable feedback and academic support to strengthen the quality of this work. My community member, Patricia Carter, the CEO and founder of Mental Wealth Services, provided essential insight from a clinical and organizational perspective, ensuring the project remained relevant and applicable to real-world practice. Together, their support, expertise, and mentorship was instrumental in successfully completing of this project. Antipsychotic medications are essential for treating psychiatric disorders such as schizophrenia and bipolar disorder. However, they are associated with significant metabolic side effects, including weight gain, insulin resistance, and metabolic dysfunction. These side effects increase the risk for developing type 2 diabetes. Individuals with serious mental illness already have higher mortality rates and reduced life expectancy, and untreated metabolic conditions worsens these outcomes. Although the American Diabetes Association recommends routine metabolic monitoring, adherence remains inconsistent in outpatient mental health settings. This highlights a critical practice gap, specifically the lack of standardized metabolic screening processes. The literature highlights several key findings. First, metabolic risks associated with antipsychotic use is well established, including weight gain, insulin resistance, and increased diabetes risk. Second, consistent metabolic monitoring is essential, but often not performed regularly. Third, that adherence to guidelines remains low across outpatient settings. Fourth, there are multiple barriers, including provider time constraints, lack of are integration and patient-related factors. Finally, system-level interventions such as provider education and EHR prompts have been shown to significantly improve screening outcomes. Our model of evidence-based practice. This project was guided by the Iowa model of evidence-based practice. The model began with identifying the practice problem, which in this case was inconsistent metabolic monitoring. It emphasizes integrating evidence with clinical expertise to guide practice changes. The model also supports implementation of evaluation, ensuring that the interventions are effective and sustainable. This project uses a quantitative quality improvement design with pre and post intervention approach. Data was collected through retrospective electronic health record chart reviews. A 3-month pre-intervention period was compared to a 3-month post-intervention period. The focus was on improving clinical processes and evaluating changes in screening outcomes. The sample for this project included a total of 85 adult patients who were prescribed antipsychotic medications within an outpatient mental health setting. This population was selected due to their increased risk for metabolic complications associated with antipsychotic use. The sample included both male and female patients and represented a diverse patient population, mirroring the typical demographics of this clinical setting. Including a diverse group enhances the relevance of the findings to real-world practice. The sample was divided into 2 groups for comparison. There were 41 patients in the pre-intervention group, representing those seen before the intervention, and 44 patients in the post-intervention group, representing those seen after the intervention was implemented. The primary measure for this project was the completion rate of hemoglobin A1C screening. This measure was selected because it directly reflects adherence to recommended diabetes screening guidelines and provides a clear indicator of improvement in clinical practice. A two proportion z-test was used to compare screening rates before and after the intervention. The significance level was set at 0.05. The z-score was 4.58 with a p-value of less than 0.001, indicating a statistically significant difference between groups. Before the intervention, diabetes screening rates were 41.5%, indicating that fewer than half of the eligible patients were receiving recommended hemoglobin A1C testing. This highlights a significant gap in adherence to established screening guidelines and suggests missed opportunities for early detection and intervention. Following implementation of the intervention, which included provider education and EHR prompts, screening rates increased to 88.6%. This reflects a marked improvement in provider adherence and consistency in screening practices. This change represents a 47.1% increase in screening rates, which in both substantial and clinically significant. Such a large improvement over a relatively short period demonstrates the effectiveness of integrating system-level supports into routine clinical workflows. These results indicate that the intervention not only improves compliance with diabetes screening guidelines, but also enhance the overall quality of care by increasing screening rates. Providers are better positioned to identify patients at risk for diabetes earlier, initiate timely interventions, and ultimately improve long-term patient outcomes. This project had several limitations. It was conducted at a single site, which limits generalizability. The evaluation period was short, so long-term sustainability was not assessed. There was also potential for variability in documentation within the EHR. Additionally, the sample size was relatively small. Now, despite these limitations, the findings remain clinically meaningful. The results demonstrated a clear and statistically significant improvement in diabetes screening, indicating that the intervention was effective in addressing the identified practice gaps. These outcomes suggest that even within a limited time frame and setting, targeted system-level interventions can lead to meaningful improvements in clinical practice. Furthermore, the consistency of these findings with existing literature strengthens confidence in the results and supports their relevance to similar outpatient mental health settings. Overall, this project provides a strong foundation for future implementation, expansion, and continued evaluation to further enhance patient care and outcomes. The results demonstrated a significant improvement in diabetes screening rates following the implementation of the intervention. This increase reflects both a meaningful change in clinical practice and a successful response to the identified practice gaps. These findings are consistent with existing literature, which supports the effectiveness of system-level interventions such as provider education and EHR-based decision support in implementing adherence to clinical guidelines and enhancing patient care outcomes. The intervention helped reduce existing gaps in care by creating a more consistent and standardized approach to metabolic monitoring. By integrating reminders and reinforcing guideline-based practices, providers were well equipped to identify patients in need of screening and take appropriate action. This project has several important implications for clinical practice, particularly within outpatient mental health settings where metabolic monitoring is often inconsistent. First, the intervention promotes early detection of diabetes by ensuring that patients prescribed antipsychotic medications receive appropriate and timely screening. Early identification of metabolic abnormalities, allows for prompt intervention, which can prevent progression to more serious complications and ultimately improve patient safety and long-term outcomes. In addition, this project enhances the quality and consistency of care by introducing standardized screening practice. By reducing variability among providers and embedding reminders within the clinical workflow, the intervention helps ensure that all patients receive the same level of evidence-based care. The project also supports the integration of mental and physical health care, which is essential for providing comprehensive patient-centered treatment. Patients with serious mental illness often experience disparities in physical health care, and this intervention helps bridge that gap by addressing both psychiatric and medical needs simultaneously. Overall, this project strengthens the use of evidence-based practice in clinical settings by demonstrating that structured system-level interventions can effectively improve adherence to guidelines, enhance provider performance, and lead to better patient outcomes. This project demonstrated that the implementation of provider education combined with electronic health records prompts significantly improved diabetes screening rates among patients prescribed antipsychotic medications. The intervention addressed both knowledge gaps and system-level barriers, allowing providers to more consistently adhere to established screening guidelines. By integrating reminders directly into the clinical workflow, the process became more effective, efficient, and less dependent on individual providers' memory or variability in practice. The intervention was not only effective but also feasible to implement within routine clinical operations. It required minimal disruption to workflow while producing meaningful improvement in care delivery. Additionally, because the components of the intervention such as education and EHR prompts can be maintained over time. The approach is sustainable in long-term practice. This project also demonstrates long-term potential scalability. Similar outpatient mental health settings can adapt this model to improve metabolic monitoring and reduce care gaps across diverse patient populations. Most importantly, the intervention enhances patient safety and quality of care by promoting early detection of diabetes, allowing for timely intervention, and ultimately reducing the risk of long-term complications associated with untreated metabolic conditions. These are the scholarly references that supported the development and implementation of this project. The sources include current clinical guidelines, evidence-based practice literature, and peer-reviewed research studies that address metabolic monitoring, antipsychotic medication risk, and quality improvement strategies in outpatient settings. Key references included the American Diabetes Association and American Psychiatric Association, which provided the foundation for recommended screening practices. Additional sources from nursing and healthcare research literature supported the use of system-level interventions such as provider education and EHR prompts to improve clinical outcomes. Together, these references ensured that the project was grounded in the best available evidence and aligned with current standards of care. Thank you for listening. I hope you enjoyed.